Session 2 is on climate smart healthcare, making things work in your context. I will start out by doing just the basics and discussing frameworks and toolkits available that can guide healthcare facilities in building climate resilient structures. Next, we'll have Dr. Renee Salas share the climate crisis, COVID-19, and emergency medicine intersections. Dr. Yash Dubal will talk about refugees, migration, and implications for emergency care. And then we'll conclude with Professor Cassandra Thiel discussing environmental sustainability in healthcare and her work in ophthalmology, as well as Mr. Lukman Yusufu, who will discuss global green and healthy hospitals, healthcare without harm, and his work in groundwork. We'll conclude with live workshop and discussions. Our objectives for this session is to be able to define climate smart healthcare, know what frameworks and guides are available for healthcare facilities, especially in low and middle income countries, are available to build resilience and protect employees and patients from extreme weather events. Explain the intersection of the COVID-19 pandemic and the climate crisis with emergency medicine practice, thinking about specific parallels when it comes to strain on resources and facilities. Lastly, discuss specific ways health systems can address environmental sustainability.
Hello everyone, this is Dr. Emily Calvello-Hines, and I have the privilege today of introducing Dr. Caitlin Rubley. Caitlin has been our primary chair for this pre-conference that I hope you guys are enjoying. She is going to be talking to us now for just the basics, explaining specific frameworks we think are critical for understanding in climate change health and emergency medicine. Dr. Rubley is an assistant professor of emergency medicine and faculty in the Institute for Health and Equity at the Medical College of Wisconsin. She serves as the current chair of the Society of Academic Emergency Medicine Climate Change and Health Interest Group, and is on the board of directors for the Wisconsin Health Professionals for Climate Action. She completed a one-year Climate and Health Science Policy Fellowship at the University of Colorado, where I was pleased to meet her, and her scholarly work has included assessing the impact of dust storms on intensive care unit admissions, management of heat stroke, strengthening emergency care systems in low-resource settings, reducing waste in emergency departments, and climate change education for health professionals, as well as racial disparities related to coal-fired power plants. She has presented nationally and internationally on building healthcare facility resilience against extreme weather events, and she's currently the clinical correlates editor for the second edition of the Global Climate Change and Human Health textbook. So we will welcome her and look forward to what she has to say.
Thank you very much for that gracious introduction. Next, we're going to talk about extreme weather events and building healthcare facility resilience in a changing climate. We'll start with extreme weather events and how they are impacting communities and healthcare facilities. I'll give you a few examples with wildfires, floods, and water scarcity. Next, we'll talk about some international frameworks by the World Health Organization that lays a foundation of which to build upon for improving preparedness in addition to response. According to the Intergovernmental Panel on Climate Change, the leading scientific body on climate change, direct and insured losses from weather-related disasters have increased substantially. Impact from recent climate-related extremes, such as heat waves, droughts, floods, cyclones, and wildfires, have revealed significant vulnerability and exposure. Again, specific populations are disproportionately impacted when it comes to extreme weather events. And often they are the ones we are seeing within our own emergency units. Climate-related hazards exacerbate other stressors, often with negative outcomes for livelihoods. Again, lives and livelihoods are impacted. Here's a brief summary of human influences to extreme weather events. Again, anthropogenic climate change is human-caused climate change. We, of almost 8 billion people on this planet, are having an impact without a doubt and are driving or fueling many of these extreme weather events. You can see here more likely or more severe or more likely to occur 69% uh, uh, with the compilation of all these studies. Feel free to go to carbonbrief.org and evaluate some more of the studies yourself. These increase in extreme weather events and disasters threaten healthcare facility operations and human health directly and indirectly. Emergency care services are challenged by resource limitations and surges in demand. Weak health infrastructure and poverty exacerbate these issues, and many locations are particularly susceptible. Perhaps it's a small island developing state along a coast at risk for sea level rise, for example, or specific flooding. Maybe it's a certain area that relies heavily on local agriculture and socioeconomic activities. And then, thirdly, thinking about climate sensitive conditions or diseases, specific areas have individual vulnerabilities. The reality is all people are at risk, although specific areas are increased risk of adverse health uh, impacts and outcomes. And so thinking about our urban areas and extreme heat in these cities compared to our rural areas and some of the vulnerabilities that they have. Thirdly, thinking about coastal areas and small island developing states, you can contextualize many of these risks. Looking specifically at healthcare facilities, there are also specific risks. Perhaps you work in a facility more like the one on the left, or perhaps you work in a facility more at the one on the right. The reality is acute care settings and emergency care can occur in a myriad of different locations, and they all have their own risks when it comes to disasters. A few of the risks that I think about within a community and health system are wastewater systems and just separating where you eat from where you use the restroom. Having potable water, not only for our patients, but employees, food as well. Again, for employees, for patients, for supporting health. Medications, really important in order to treat many of the emergent conditions that we see. Having energy, and not only energy in general, but continuous energy and access to energy in order to meet the needs of our patients. For example, operating theaters and not having continuous energy can pose a significant threat to emergency care because we don't have a definitive uh, treatment to an infection, for example, that requires surgical intervention. Next is transportation. That includes transportation of resources in order to stock our emergency units so that we can provide care, but also includes transportation of people, getting employees to a healthcare facility so that they can work in medical facilities. Also, having a system, perhaps an emergency medical services system of care when you call a number or when you get transportation in the means of life-threatening illness, are you going to make it there? Or are there, for example, roadways that are blocked by floods or fires? And then lastly, the very basic infrastructure. Does your facility or your care facility have a roof? Does it have a door? Does it have energy infrastructure? Now, when I think about emergency care systems, it's pretty complex. This is the World Health Organization definition, and so it focuses on scene, transport, and facility. That looks very different across the continent and even within many of your countries. If we focus over on the right-hand side at the facility, there's the reception, emergency unit care, disposition, and then inpatient care handoff. That will be most of our focus today. How do we protect the facilities of which we provide care? There are many risks for the facility. I really like this image from British Columbia in Canada. And it talks again about the acute and chronic climate stressors, extreme weather, rising temperatures, sea level rise, and then the specific risks to the facility. Again, direct infrastructure, energy system impacts, supply chain disruptions, health service disruptions, inpatient care. If we go back to our list again of significant risks during disasters, we can apply these specific threats directly to healthcare facilities. If we don't have reliable energy infrastructure or communication or warning systems, it may impact our ability to provide high quality, timely emergency care. So the question is, what are we going to do about it? And so this comes down to the World Bank organization. So the World Bank and Healthcare Without Harm are two organizations that have partnered on climate smart healthcare. Climate smart healthcare, very simply, is low carbon healthcare and building resilience in the setting of climate change. And so sustainability addresses this low carbon healthcare, looking at mitigation, reducing greenhouse gas emissions. In the United States, for example, where greenhouse gas emissions from the health sector are about 10%, really, really important. However, it's also important to build resilience in the setting of these extreme weather events. There is some overlap. So as examples here, you can see sustainability, looking at recycling, looking at care closer to home, or even some of the telehealth opportunities. With resilience, it's more preparedness and planning in the setting of disaster. It's also backup generators that aren't in the basement of a facility, for example, which are at highest risk of flooding, but generators that are perhaps higher up. And so that even if the basement floods, the generators are still operating and you can rely on them as a source of energy during in the face of its stressors. And then there's some overlap with sustainability and resilience, things like universal health coverage and just getting access to healthcare for people. The next section, we're going to focus on resilience. Just to remind you of the definition, it's the ability of a system to anticipate, absorb, accommodate, or recover from the effects of a hazardous event. I want you to think of it as ensuring essential function and operations, even in the setting of stressors. For us, that means how do we keep our emergency units open and acute care accessible to people, even in the face of disaster. The World Health Organization came out with this framework in 2015. It provides 6 building blocks of health systems for them to be climate resilient. And essentially, it's climate resilient health systems that support community resilience and preparedness. It answers the question of when, not if. When the disasters come, will your community and health system be ready? And so the 6 main building blocks: finance, leadership and governance, health workforce, and that includes a trained workforce that recognizes the threats of climate change and their connection to human health, health information systems, essential medical products and technologies, as well as service delivery. The next part, I want to talk about some extreme weather cases that highlight disruptions in these 6 building blocks that influence patient care. One example is dust storms. So across much of the regions, you are familiar with haboobs or dust storms and their impact on respiratory health. I did a study, it was mostly in the Southwest United States, and I compared uh, intensive care unit admissions uh, uh, on the day of the dust storm. And what we found, not surprisingly, was an increase in respiratory admissions on the day of the dust storm by over 9%. Compared with other zip codes, as well as an increase in total intensive care unit admissions on the day of the dust storm. This is an image by NASA of South Africa. Again, very large dust storms, but you can think about it within your own populations in your cities. How does it impact an aging population who have more respiratory diseases, for example, or in the setting of coronavirus, where there are more people perhaps on supplemental oxygen? Thinking about shortages of trained practitioners, especially in the critical care area. Do we have the resources and trained personnel and machinery necessary in order to treat these patients? Even very simply thinking about inhaler use. Is there inhalers or medications available to treat individuals when these dust storms increase? As an emergency medicine physician, I also think about injuries, reduced visibility secondary to dust storms, and the potential car crashes and other trauma that can result. Extreme heat is another example. In 2010, there was a heat wave in India, and they actually did a study on their very youngest patients in the neonatal intensive care unit. And what they saw was an increase in admissions in their hospital in the neonatal intensive care unit for heat. There were 24 admissions when usually there's 4 or 8. There was no air conditioning in the hospital. And so then they put together a team and were able to restructure and move to reduce risk to these youngest patients. Other studies have found an increase in heat drives emergency department admissions, especially during heat waves. That contributes to surges in care and, again, resource utilization. Wildfires is another example that contributes to poor air quality, and it can travel many, many kilometers, resultant particulate matter that is influenced, and we know there are myriad of downstream health impacts related to poor air quality. In the world, 7 million people die prematurely secondary to air pollution every year. That's indoor and outdoor. This was an image from NASA from 2019. You can see the red in many countries of Africa highlights wildfires, in contrast to South America, which has received a lot of attention when it comes to wildfires. Just significant destruction and not only air quality, but patients who are burned, workers, thinking about those people who fight fires, and then continued water scarcity, wind, drought conditions, and extreme heat that ends up fueling more fires. Tropical cyclones. This is for resource utilization. Hurricane Maria hit Puerto Rico in 2017. They affected large and small volume sailing bags. Here in the United States and other parts of the world, there was sterile saline shortages well over a year because that was where many of the sterile sailing bags were manufactured. Right on your continent, you had your own tropical cyclones in 2019, one of the most destructive in history. These were a few statistics that I pulled from the United Nations, but this is no surprise to any of you. Cholera after the flooding, displaced populations, crop damages, and resulting impact on economic resources as well as food security. And then looking at healthcare facilities, 93 healthcare facilities impacted. in the acute time frame, what does that mean for emergency care and treating patients, but also the loss of access for months to years down the road. What does that mean for population health? One example from New York was Superstorm Sandy. It hit in 2012. There were 43 deaths, more than 6,000 patients evacuated from 37 healthcare facilities. But what I wanted to share with you was the impact. This was received via a survey. And as you can see, there are many different faults within the system. So communication, heating and cooling, utilities, equipment, the building directly having impact, and then staff. Very simply, it's just a whole cascade of threats and faults within our complex health systems. So what are we going to do about it? How are we going to transform? Just to remind you, we have our health systems, we have some shock or stressor. Again, we're looking at disasters now. There is different vulnerability. You can talk about exposure, sensitivity, adaptive capacity. Some describe resilience as decreased vulnerability and increased capacity, improved choices and opportunities. And so you have this constellation that derives various outcomes. And so what is the outcome that we want? And we want to transform. We want to hit on some of these upper outcomes. We don't want to collapse. We don't want to recover. We want to transform our system and recover better than before. And so how do we prepare now for the when rather than if a disaster hits scenario within our own communities? And just recently, this framework was launched. It's a framework for building climate resilient and environmentally sustainable healthcare facilities. And so you have various climate change events that disrupt care and services in healthcare facilities. You can look at health workforce, water, sanitation, hygiene, and healthcare waste, energy and infrastructure technologies and products. And then there are various environmental impacts. Greenhouse gas emissions drive further climate changes, but you can build climate resilience to support healthy people and a healthy environment. They propose these 5 steps and process in order to support climate resilient healthcare facilities. So number 1, assemble and train a multi-sectorial operative team. Again, these include engineers, health professionals, purchasers, food and nutrition services professionals, and many other partners. Number 2, establish a baseline. Number 3, define and prioritize short and long-term interventions. 4, develop and implement an improvement plan. And 5, monitor and evaluate improvements. All right, so that brings us to our last section, which is toolkits and guidance documents for healthcare facilities themselves. So the Smart Hospitals Toolkit is part of the Pan American Health Organization, and they have a hospital safety index, green checklist, cost benefit analysis, and training aids for South America and the Caribbean. Their 3 pillars are safe, green, and smart. Dr. Balbus and colleagues have published on resiliency toolkits. Again, looking over at the right side, this is the Pan American Smart Hospitals Toolkit. That will be our focus. Just so you're aware, the United States and Canada do have a couple toolkits and other guidance documents available. You are welcome to peruse them. I actually find their case examples really helpful in seeing what others have done in regards to what's feasible and how you can partner in order to address a specific issue. Georgetown Hospital in St. Vincent and the Grenadines focused on infrastructure. And so you can see the before picture and the after picture. They installed solar panels, they redid the roofing, they improved energy resilience, they focused on leaks from water, and then doors to reduce leakage and address heating and cooling costs. And what they found was a 58% reduction in electrical consumption following the update. This directly translates to return on investment in only a few short years after the updates. People's Hospital in the British Virgin Islands is another example. Essentially, they updated to what is deemed a grade A hospital. When Hurricane Irma hit in 2017, there was only a small fault in a window. Otherwise, they were able to remain operational and were actually the beacon of hope and a pillar of light for the city that was completely decimated. All emergency operations moved to the hospital because it was the standing facility. And so, in the wake of extreme stressors and challenges for their community, it was able to support people and operations in order to move ahead. Now, there is also a climate change and health diagnostic by the World Bank. Madagascar partook in this and they focused on nutrition. It's essentially the essential goal is to reduce morbidity and mortality in a comprehensive way. You can explore that, but there's also a World Bank document that gives many different examples. This is one example where the hospital collaborated in reducing its energy consumption, and it had significant cost savings as well as produced more than 4,000 jobs. This is just the 5 stages as part of the climate and health diagnostic. There's a pre-diagnostic review, there's a launch workshop, field visits and interviews, prioritization session, recommendation, and action plan. I just want you to be aware of this. It essentially guides communities in addressing threats, creating feasible action plans and objectives, and so that they are able to make it happen based on whatever financial and human resources are available. And then I just wanted to share a few other studies, case examples. You are more than welcome to click through them after this, but again, focusing on renewable energy, energy efficiency, and then this was the low carbon building, which we talked about in Rwanda. Many cities are taking this into their own hands as well. This is the capital city of Ghana is part of the C40 Cities Initiative for Climate Leaders. And what they came up with was a climate action plan. And one of their goals with their own hospital was to double the energy efficiency by 2030. So again, coming up with feasible goals and objectives and a plan to get there. All right. So we talked about a lot of different risks and opportunities available to healthcare facilities and healthcare systems. Just to ground us again, there are various climate change hazards that affect facilities themselves, as well as emergency care systems. There can be direct and indirect impacts to health and patient care service delivery. Here are 2 other reports and resources that you might be interested in. Safe Haven in the Storm is part of Healthcare Without Harm, and it essentially goes through several case examples and highlights the costs of disasters when it comes to human health and service delivery. And then the second one is in the Maldives. It's a Green Climate Smart Hospital. They did a hospital vulnerability analysis and report in order to build resilience as an island nation. So healthcare facility resilience is community resilience. We can build to last, and I think it's really exciting thinking about in the next 5, 10, 15, 20 years, what we can envision for our communities in order to prepare and respond better. And then lastly, I just want to leave you with this. Healthcare facility resilience and ensuring emergency care service delivery, supports the Sustainable Development Goals as part of the United Nations. It also supports the Sendai Framework for Disaster Risk Reduction and healthcare as a human right. And so there are many opportunities for you to intersect within this community and advance climate action and build climate resilient healthcare facilities and systems within your own country and community.